Okay, so at this point, I'm going to walk in the room and I'm going to introduce myself to the patient. And I'm going to identify him using two patient identifiers. And I'm going to perform hand hygiene when I walk in the room. And then I will confirm his two patient identifiers by looking at his wristband. And at this time, I'm going to assess how he's doing. And I'm going to ask him on a scale of 1 to 10 how his pain is doing today. And then after this point, I will raise the bed and I will put him up to the correct position. And I'm going to educate him about that. I'm about to change his wound dressing and everything that's about to take place. And then at this point, I'm going to put on my non-sterile gloves. And I am going to open the wound dressing at this time. Now I'm just going to take off everything that was in here, and I'm going to dispose of it in the proper receptacle. And then at this time, I'm going to assess how the wound looks. So I'm going to be looking for things like color, odor, drainage, the thickness of any drainage that's in there, the amount of it, and then I'm also going to measure the length of the wound using a ruler. And so I'm going to measure to make sure that it's healing correctly and that we aren't going in the opposite direction. So then I'm also going to ask about his tenderness when I'm doing the assessment, and I'm going to also look for any redness or signs of infection or things like that. And now I'm going to dispose of my non-sterile gloves. And I'm going to perform hand hygiene, and now I'm going to get ready my sterile field. So getting ready the non-sterile field, I'm going to make sure that everything stays above my waist level and that I'm opening it correctly. So this is going to be my drape. I need to make sure to keep my 1-inch margin. And now I'm going to open the other things. Oh, and I'm going to dispose of all of these as well in the proper receptacle. That would fall so. And then dispose of that. Then I'm going to open my saline at this time, and I'm going to pour it on my gauze. And at this time, I'm going to get ready my non-sterile field to put on my sterile gloves. And you're only touching the 1-inch margin. So I would make sure that it was not going over my sterile field like it was. I would have a totally different sterile field for this. And at this time, I'm going to put on my gloves. So I'm going to touch it. You can touch the inside. Like making sure that it doesn't touch my skin. And now that my sterile glove is on, I can touch the outside. And now that my sterile gloves are on, I'm making sure that it stays above my waist. And I'm going to begin by measuring the depth of the wound. So I'm going to take this and measure the depth, going to the deepest part. And I might even break it off at this point, or I might just take note of where it is, and I will keep, I don't think I would put it back in my sterile field, but so I would keep note of where it was on here. And then I'm going to take the gauze and put it in my hand, like so. I'm going to clean from cleanest to dirtiest on one side, dispose of in the proper area. Take another gauze and clean down the other side from cleanest to dirtiest. And then I'm going to take the third gauze and do the same thing, cleanest to dirtiest, but this time I'm going to go down the middle of the wound. And now, with the fourth one, I'm going to pack the wound. So I'm going to put it in to the wound like so, and this one's also wet, and might use a Q-tip to help me pack it in there better. And then I'll dispose of this. And at this point, I would also make sure to have another dry gauze, and I would put that on top of the wet. And then I would take this larger pad, and I would just place it right here on top of that. And then I would be sure to close this up, and then I would go ahead and I would take off my non-sterile gloves, perform hand hygiene, and dispose of those in their proper site. And I would document things like the color, the odor, everything that I assessed in the beginning, the length, the depth, and I would measure or like take note of his tolerance, what he said his pain was, just things like that. And then I would leave my patient, I would put the bed down, and I would put the rails back up, and I would communicate with him about what's gonna come next, and make sure that he's comfortable, put the call light by him, and